This is Dr. Morey with Uncivilized Vitality, the Uncivilized Anatomy playlist. We're continuing anterolateral abdominal wall. We're talking about the regions now. That's other video we went through the muscles real briefly and the layers of tissue that make up the abdomen and surround that abdominal pelvic cavity. And then let's talk about how we can divide that up. So if we're looking at someone, here's their abdomen and their pelvis, and the abdomen goes up like this. There's their belly button. There's their pecs. Their belly button's out of the center. And then that's kind of where their ribs are at, right? And you've got this body that hangs down. There's a couple ways we can divide up the abdomen so we can refer to it from a surface anatomy. The simplest way is to just draw a transverse line and a vertical line through the umbilicus. This just divides us up into quadrants. We have a right upper quadrant and a left upper quadrant, a right lower quadrant, and a left lower quadrant. All right. So using that as a quick and dirty way to divide this up so you can talk about structures in the quadrants. And don't forget that it's the body's left and the body's right, not your right and left. Don't mix that up when you're referring to the quadrants. And then you can take some broad strokes once we get to internal viscera. I know that my liver and gallbladder are in my right upper quadrant, or my right lower quadrant has my appendix. My sigmoid colon and descending colon are going to have most of my trouble show up in the left lower quadrant. My spleen and stomach hang out mostly in the left upper quadrant, so that kind of thing. Quadrant's pretty easy, pretty quick to do. Makes a lot of sense. Another way that the body can be, or the abdomen can be regionalized, when you get a little more specific for anatomy terms, put the umbilicus back there, is we're going to do like a tic-tac-toe. So we're going to draw two lines that are going to be basically mid-clavicular. So I draw one line down from the middle of the clavicle all the way across, then I'm going to draw two horizontal lines. This one's going to, the lower of the two lines will be called the transtubercular line. On your iliac crest, there's a little knob called the iliac tubercle. I'm just going to draw a line there, and then the upper of the two horizontal lines would be the transpyloric line, if you kind of can guesstimate where your pylorus is, or this would be at the bottom of about rib 10 and like the first lumbar vertebra. Right? So this gives us 9 quadrants. Obviously, this one here will be the umbilical region. Did I say 9 quadrants? I meant 9 regions. This is the umbilicus, or the umbilical region. Above that will be your epigastric, because this is the region that is above your stomach. A lot of times people think the actual stomach is lower than it is. It's actually quite high in the abdomen, just under your diaphragm, where you get that esophageal hiatus, and the stomach is tucked up there. Now you've got these, down here. This is going to be your pubic region, because it contains the pubic symphysis at the bottom. Epigastric, above your stomach, or on top of, think of that, the umbilicus or umbilical region, where it contains the umbilicus, then the pubic region just above your pubic bone in that center line. Your two lateral columns of structures are going to be right and left, so it'd be the same on both sides. Down low, just lateral to the pubic region, you have the inguinal regions. The inguinal regions, left inguinal, because it contains that inguinal ligament, inguinal fold, deal with some of your inguinal hernias and such down in that lower lateral region. The regions that are just lateral to the umbilicus are going to be called the lumbar, or an older word I like for some reason, flank. Right, so that'd be your flank. That's where you get your flank steaks from. So that'd be your flank. You take a good punch in the flank. You're vulnerable to injury in the flank. So that's what you mean. That's what's meant when somebody says, you've heard the term like we got outflanked. That usually means coming around from the side. And then you have the hypochondriac regions. This is refers to just below the chondrium of, or the cartilage of the ribs. So this is the costal cartilage, and it's just below that, so the hypochondriac region. And you know that term from somebody that complains a lot about imaginary aches and pains. Hypochondriacism would be an old code word that doctors would use to write in their charts when they had a patient that complained of, where does it hurt? Just kind of here. So they couldn't really pinpoint anything necessary, so they would eventually write, this patient suffers from hypochondriasis, because it was just sort of code that was like saying subjective complaints do not correlate with objective findings. That's just a way of saying that you patients, what they're saying is hurting is not really what you're finding. So that's how that kind of started. But these are the 9 regions. You have your right hypochondriac, epigastric, left hypochondriac, right lumbar or flank, umbilicus, left lumbar or flank, right inguinal, pubic, left inguinal. So those are the 9 regions of your stomach. Now, if you're studying anatomy in a course, you'll want to attach viscera that is typically found in the 9 regions. So if you have like a lab exam or something, and you come in and I have, let's say, a large flathead screwdriver inserted into the cadaver in the right flank, depending on the angle and length of this implement that has impaled this person in the abdomen, I might ask a question in a class such as, what viscera are at danger? What is likely to be damaged in this region given this angle and length of penetration? Yada, yada, yada. So that would be the 9 regions. You could use that like on a test. Now, another thing you should know about the abdominal wall, just generally, speaking of impalement, is the vasculature. So you're going to have your internal thoracic artery coming down from above off the subclavian. Don't worry about that right now. Or sometimes called the mammary artery. Internal thoracic coming down from above. The internal thoracic is going to give you 2 branches. One kind of center line, which is going to be your superior epigastric artery that supplies the abdominal wall, and one that runs along the ribs and down, called the musculophrenic artery. And then it'll be on this side as well. So you have another internal thoracics, right, and then a musculophrenic. These arteries will anastomose with the inferior epigastric. Along the center line, the anastomose, and then the musculophrenic will anastomose out here off of the external iliac artery. Okay. So this is this is basically the blood supply of the abdomen. These large arteries that are going to supply those muscles and skin. And the innervation is just intersegmental. We'll go over that in a little more detail. And when we do the video on the vasculature of the region, specifically we'll do this with the tie-ins off the subclavian, the external iliac, and some of the deeper blood supply. So that's the regions. Check out the other video on the abdomen. The next video I'll do will be a cross section so we can see the intersection of the tendons of the internal, external obliques and transverse abdominis, how they come together, delaminate to split internally and externally, and tie together in that linea albicans to form that rectus sheath, because that's a little more complicated to draw just on the board. I'll have to think of a way to draw that in a cross section that'll make sense here. So that's it. If you had fun looking at that video, give us a thumbs up and leave a comment about which anatomy part you'd like to see next, because I just sort of do these in a haphazard way. So enjoy.